Dr. Abdelaal, you are the chief medical officer for the Visiting Nurse Service. How does your role as a doctor also deal with the policy arena?
I think the role of the doctor, when I try to explain my role, I usually go in and say, first thing that we're taught in medical school is do no harm. And I think that's really my role in the organization is how we can make sure that we don't do any harm to this population, or just make sure that people aren't harmed who live in our communities, and making sure that they get the best available care. I think quality is one of those key things that, transparency is becoming really out there, and there's quality goals, and that's what we have to strive for, is knowing who's the best at doing that so people can have beneficiary choice and choose the right provider, the right healthcare agency. And it's something that's been going on for the past 10 years, but most recently it's out there. The numbers and the metrics are out there, and I think as the years go on, they're going to be better and better.
One of the questioners in our conference today brought up this notion of an aging tsunami coming for our country. Is that an accurate depiction of some of the challenges ahead of us?
I think the population is aging. I don't believe it's a tsunami, in that there's a congressional budget office from Peter Orszag that he really went across the nation and said, what is costing our health care to really go high, and how are we going to break the bank? The reason wasn't the aging of the population, because the theory there is that even though the population is aging, people are healthier and actually living longer, so the whole utilization of services happens at the end of life. What's really costing us a lot of money is the cost of healthcare and really new technologies that are being utilized. So to me, that's something that has to be addressed. Are we utilizing the best care for the best time, for the best moment? Are we using the right drug, the right surgery, the right machine? And what evidence do we have that really shows that? If we start looking at comparative effectiveness and really comparing and doing studies about what works and what doesn't work, I think we'll get there. I think we'll be able to tolerate the tsunami.
In order to deal with these rising costs, are you saying that it's a matter of being more precise in the way that we administer tests and all sorts of ways that we can deal with medical problems? Or is there also something that we can do governmentally, maybe to subsidize costs?
I think we should be looking at utilization. So a lot of these accountable care organizations, managed care, or any sort of system that's being built right now is really based on bundling payments and getting away from the fee-for-service. If we get away from getting paid for the widget and how many widgets we do, and getting paid by, did we effectively treat people for hypertension? Did we effectively treat people for diabetics? Or did we do that surgery on their knees and really get them mobile and out in that certain time? And doing those comparisons on who's good and who's not, I think it'll get us there. I think that's a part of it.
How has the implementation of the Affordable Care Act impacted the Visiting Nurse Service?
I don't think there's an organization or an agency out there where the ACA really hasn't impacted. When I go around and speak sometimes, I say, you talked about tsunamis, but we had two big events, major life-changing events in the healthcare world. That was the ACA, and then at the same time we had Medicaid redesign. So before those two came along, it changed all of the definitions on every healthcare episode right now. So it's a great time. It's a time of change. It's one that's being really seen and observed throughout all of the industries, and everybody is trying to redefine who they are or how they're going to survive in the new world, because we know the old world cannot exist or cannot be maintained. So therefore, we just have to try and figure it out.
The mission of your organization is so vast. You care for people from cradle to the grave. What are your kind of principal focuses, given the immensity of the job that you have as Chief Medical Officer for an organization with this scope?
It really pleases me to be a part of this organization. I was involved in one of their examples of being a mission-driven organization. When Superstorm Sandy hit, we were out there in 2 days, going out and making sure that people were taken care of. We don't take care, we're not looking at this from what the city or the state or everybody is asking us to do. We want to do this on our own. We feel it is our mission to go out there and support our community. And that's really where the heart of VNSNY is, and that's what it was built on 125 years ago by Lillian Wald, who's the first real base community nurse. And it's amazing that the company, after 125 years, still has that feeling and that passion there. And you could ask anyone who works there, they still feel that passion and mission.